Good afternoon and welcome to today's information session for the 2026 funding opportunity, also known as the NOFO. Applications 2.1 accelerate the use of agentic artificial intelligence, also known as AI, solutions to clinical care and/or clinical trials. 2, expand Lantern's application programming interface, API, monitoring capabilities by integrating secure community-driven feedback that complements existing automated checks. And 3, assess laboratory interoperability gaps to improve the adoption and use of standard terminology among small independent laboratories. This notice of funding opportunity is being under the Leading Edge Acceleration Project, also known as LEAP, in Health Information Technology. Today's agenda includes an introduction of speakers, reminders, background on the LEAP in Health IT, the NOFO, and application responsiveness and review criteria. Today's speakers will include myself, Yolanda Thompson, from the Office of the National Coordinator, Office of the Chief Operating Officer, Procurement and Grants Division, and Priscilla Awusa-Mensah from the Office of Standards, Certification and Analysis, Technical Strategy and Analysis Division, Strategic Initiative Branch. Just a few reminders, this webinar is being recorded and will be made publicly available. All participants will be muted during the presentation. If you have questions, please enter them into the chat box. Note, all questions will be answered in a frequently asked questions or FAQs made publicly available on a rolling basis. Webinar and FAQs will be made available at the healthit.gov Funding Opportunities Leading Edge Acceleration Projects or LEAP Health Information website. How to ask a question during today's presentation. If you have a question, use the chat box function. Along the bottom of the webinar window, you will find and click the chat button. Input your question into the box and hit return or send. If you have additional questions after today's webinar, please direct them to the following email address, onc-leap@hhs.gov. I will now turn it over to Priscilla to provide a background on the LEAP and Health Information Notice of Funding Opportunity.
Thanks, Yolanda. So to start, I will give a brief overview and background of the LEAP program. Since 2018, LEAP in Health IT seeks to address well-documented and fast-emerging challenges that inhibit the development, use, and/or advancement of well-designed and interoperable Health IT. Next slide. Applications submitted under this NOFO will be funded under the LEAP in Health IT NOFO. Aside from the areas of interest, required expertise, and deadlines listed in the NOFO, all other requirements, application instructions, and terms and conditions of the NOFO apply. Next slide. Eligible applicants. This is a competitive funding opportunity open to public or nonprofit private institutions, such as a university, college, or a faith-based or community-based organization, units of local or state government, eligible agencies of the federal government, Indian, Native American tribal governments, federally recognized, other than federally recognized and tribally designated organizations. For-profit organizations may participate in projects as members of a consortia or a subrecipient only. Because the purpose of this NOFO is to improve healthcare in the United States, foreign institutions may participate in projects as members of a consortia or a subrecipient only. Applications submitted by for-profit organizations or foreign institutions will not be reviewed. Organizations described in Section 501(c)(4) of the Internal Revenue Code that engage in lobbying activities are not eligible to apply. Next slide, please. The U.S. Department of Health and Human Services Grants policy requires that the grant recipient perform a substantive role in the conduct of the planned project activity and not merely serve as a conduit of funds to another party or parties. If consortium or contractual activities represent a significant portion of the overall project, the applicant shall justify why the applicant organization, rather than the party or parties performing this portion of the overall project, should be the recipient and what substantive role the applicant organization will play. Applicant organizations may submit more than one application, provided that each application is scientifically distinct. Next slide, please. We'll now go into the details of the areas of interest in this year's NOFO. Below is an overview of the NOFO, which has 3 areas of interest and 1 award per area of interest. Area of interest 1 will be awarded up to $1 million, and area of interest 2 and 3 will be awarded up to $500,000 each, with a period of performance of 2 years. Applicants are encouraged to submit their applications based on a 3-year budget period. Additional funding for year 3 may be provided contingent upon availability of funds, meaningful progress, and ONC priorities. Letters of intent are not required in order to be considered for an award. However, if you are planning to submit one, they are due by June 30th, 2026. Applications are due by July 16th, 2026. I will now give an overview of each area of interest. Area of interest 1 is to accelerate the use of agentic artificial intelligence solutions in clinical care and/or clinical trials. Area of interest 2 is to expand Lantern's API monitoring capabilities by integrating secure, community-driven feedback that complements existing automated checks. Area of interest 3 is to assess laboratory interoperability gaps to improve the adoption and use of standard terminology among small independent laboratories. Please note that applicants shall clearly state which area of interest the proposed project will address. Application packages addressing more than one area of interest will not be considered for an award. You can do this in the project abstract and the project narrative. In the area of interest 1, there will be 1 award given for up to $1 million on the topic of accelerating the use of agentic artificial intelligence solutions in clinical care and/or clinical trials. The goal of this area of interest is to accelerate the use of standard-based agentic artificial intelligence technologies to advance clinical care and enable innovation through AI. The area of interest builds on the recently released request for information, accelerating the adoption and use of artificial intelligence as part of clinical care. Next slide. Next, I will share the applicant required expertise. For area of interest 1, the applicant's proposed project team should possess and demonstrate the following at a minimum: experience developing, deploying, and validating artificial intelligence and machine learning models in healthcare settings, including integration and clinical workflows in EHR systems. Familiarity with agentic AI architects such as goal-directed systems, autonomous task orchestration, and tool using agents and their safe application in clinical environments. Understanding of Health IT standards to support interoperable standards-based integration. Next slide. The key objectives for area of interest 1 are to develop or adapt an agentic AI solution for at least one specific clinical and/or clinical investigation workflow. For example, patient triage, diagnosis support, care coordination, clinical trial enrollment, and etc. The solution should improve an existing process or create a new process that was not feasible without AI. Conduct at least 1 pilot project demonstrating end-to-end agentic AI functionality in a real-world clinical setting of the agentic AI solution. As part of the pilot project, successfully integrate the agentic AI solution with at least 2 different Health IT system platforms, demonstrating cross-platform compatibility. Apply a risk management methodology to evaluate the agentic AI solution used in this project and publish a detailed assessment report. Conduct at least one educational workshop or webinar for appropriate stakeholders within 12 months of the award date. The workshop or webinar should document the current state of agentic AI in health IT and provide stakeholders with information about the current status of the project and the solution being developed. Next slide. Applicants must publicly release 100% of the developed software components under an open source license, accompanied by complete technical documentation, installation guides, and user manuals. Submit for publication at least one peer-reviewed paper or white paper documenting the project findings, recommendations for use by health IT developers, best practices, and lessons learned by the end of the 24-month period of performance. Form a technical expert panel of key stakeholders to advise the project team throughout the period of performance. The coalition could include approximately 10 stakeholders and meet at least 3 times during the period of performance. Stakeholders could include, but are not limited to, clinical and care delivery teams, patients and patient advocates, AI machine learning engineers, software developers, health IT specialists, privacy and security experts, and clinical informatics specialists. Applicants should include letters of commitment from proposed members of the panel. Next slide. Next, I will review Area of Interest 2. In Area of Interest 2, there will be one award given of up to $500,000 on the topic of expanding Lantern's API monitoring capabilities by integrating secure, community-driven feedback that complements existing automated checks. The goal of this area of interest is to enhance Lantern's ability to monitor FHIR endpoints by adding a secure, community-driven feedback layer that complements existing automated checks. This project will enable implementers, vendors, app developers, and certification bodies to share actionable information about real-world API behavior, improving reliability, transparency, and trust in FHIR APIs across the healthcare ecosystem. Next slide. For Area of Interest 2, the applicant's proposed project team should possess and demonstrate the following at a minimum: understanding of Lantern and its current API monitoring and reporting capabilities, familiarity with HL7, FHIR APIs, and related health IT interoperability standards, and experience developing secure, authenticated feedback submission mechanisms. Next slide. The key objectives for Area of Interest 2 are to identify the types of information related to performance, accessibility, data quality, and implementation experience that would be most valuable to entities seeking to discover, access, and use a range of FHIR endpoints beyond those currently focused on patient access. The information could be informed by analysis of the Lantern monitoring system, other efforts to gather feedback on the endpoint performance, such as bulk FHIR, and input from stakeholders across the health IT community. Examples of potential data types may include performance issues not currently captured, authentication or authorization failures, assessing the availability or completeness of data, errors encountered during the process of accessing the data, data timeliness, accessing the accuracy of the documentation, and observed workarounds or implementation patterns. Create a technical solution integrated with the Lantern open source tool that enables the collection and incorporation of the information identified in Objective 1. The project must support standardized data collection so information is captured in a consistent, structured, and comparable format across endpoints, such as through a structured or semi-structured reporting tool linked in a specific endpoint. Next slide. Develop visualizations and other features that could be used within the Lantern system for categorizing and displaying community feedback so that feedback is integrated with the information that is currently monitored by Lantern. Additionally, features should accelerate issue detection, support collective problem solving, and improve transparency. Generate a machine-readable, downloadable report at the developer level that summarizes information for each endpoint. For each endpoint, the report should include endpoint status, a summary of community feedback, and the existing monitoring approach. The report must be accessible to download using technical solution developed in Objective 2. Solutions shall rely on non-proprietary approaches and be independently implementable. The solution must be open source and available on GitHub with complete technical documentation, installation guides, and user manuals. Form a technical expert panel of key stakeholders to advise the project team throughout the period of performance. The panel should include approximately 10 stakeholders and meet at least 3 times during the period of performance. Applicants should include letters of commitment to interested parties. For Area of Interest 3, there will be one award given for up to $500,000 on the topic of assessing laboratory interoperability gaps to improve the adoption and use of standard terminology among small independent laboratories. The goals of this area of interest are to assess laboratory data quality and implement existing solutions aimed at improving the adoption and use of standard codes such as logical observation identifiers, names and codes, LOINC, SNOMED clinical terms, SNOMED CT, and unified codes for units of measure, UCUM, among small independent laboratories. Projects should assess the laboratory data quality and the use of the information to identify and pilot test different solutions, such as mapping tools to facilitate the use of correct codes and laboratory data, and to transition small and independent laboratories from using local codes to using standardized terminologies. Projects should focus on solutions that support conformance with laboratory standards and can be widely implemented by small independent laboratories. Next slide. For Area of Interest 3, the applicant's proposed project team should possess and demonstrate the following at a minimum: familiarity with national laboratory terminology standards, understanding laboratory data quality and standards conformance challenges, experience engaging with the Health IT standards community and stakeholders across the laboratory community. Next slide. The key objectives for Area of Interest 3 are to identify at least 3 small independent laboratories to participate in pilot activities that will improve the adoption and use of standard terminologies and support conformance with LOINC for laboratory test identifiers, SNOMED CT for results, organisms, and methods and conditions, and UCUM for units of measurement, and align with applicable USCDI data elements. Conduct a readiness assessment for each participating laboratory to understand if the laboratory staff are prepared to change their laboratory coding processes, understand if the laboratory's IT system is capable of adopting new laboratory coding processes, identify risks and challenges the laboratory will face in adopting new laboratory coding processes, identify laboratory coding processes needing improvement, identify how changes and success will be measured, identify the most appropriate tools for data quality assessment and mapping, and identify any other topics the applicant determines to be necessary. Next slide. After the readiness assessment, pilot test at each participating small independent laboratory at least one open source data quality tool to identify laboratory tests that the laboratory staff has frequently incorrectly coded or coded using local codes rather than standardized terminologies. Once the laboratory tests that are incorrectly coded or coded with local codes are identified, determine the root causes of incorrect and local code use. Once the tests that are most frequently incorrectly coded or coded using local codes rather than standardized terminologies are identified, pilot test at each participating laboratory 2 or more tools to improve the use of standardized terminology. Existing tools are available through LOINC, Regenstrief, and from the SHIELD community, such as Realma, Search LOINC, LOINC Hierarchy Browser, LOINC Mapping Guides, Laboratory Information System Mapping Tools, and existing LIVD specifications. The applicant may use these tools or other open source tools to transform the incorrect or local codes into standard codes to increase the usage of standard codes at each participating laboratory. Next slide. Describe in a report the results of the readiness assessments and root cause analysis and lessons learned from the pilot testing of tools that measure the quality of laboratory data and the tools that support the use of standard terminologies on a broad scale. Also describe in the report how the tools used can improve consistent adoption and use of nationally recognized laboratory standard codes. Based upon the lessons learned, the report should include specific recommendations to update and improve existing tools to better support use by small independent laboratories. And lastly, develop a dissemination plan that will include a public-facing version of the report described in Objective 5 and at least one educational workshop or webinar to share the results from the readiness assessments and root cause analyses, lessons learned, and to explain how laboratories can adopt standardized laboratory codes with data quality and laboratory stakeholders. Next slide. All tools and any developed processes or suggestions for adopting standardized laboratory codes should be interoperable with third-party client applications developed by unaffiliated organizations to support mapping, validation, and assessment of laboratory standard code usage. All tools should also be use case agnostic and support laboratory interoperability by enabling consistent use, validation, and assessment of standardized laboratory codes. Applicants should rely on non-proprietary approaches and propose solutions that are independently implementable and applicable across multiple laboratory data elements, using a technical approach to support diverse laboratory and data quality use cases. Applicants shall include a technical expert panel of key laboratory and health IT stakeholders who will be directly involved in the project, such as laboratory information system, LIS vendors, leadership from small independent laboratories, developers from third-party laboratory data quality or terminology tools, public health partners, and members of the laboratory and health IT standard communities. Applications should include letters of commitment from proposed members of the coalition of key laboratory and health IT stakeholders. Next slide. For area of interest 3, applicants shall include the following in their application. So describe in detail technical barriers that impede laboratory interoperability, including challenges related to the adoption and use of standardized laboratory codes, data quality conformance to national laboratory standards, and integration with third-party applications. Describe in detail technical solutions to the barriers, including sufficient technical details to demonstrate that the proposed solution is based on non-proprietary technologies and leverages open source tools, a detailed plan on how the applicant plans to conduct the readiness assessment for using data quality and mapping tools from Objective 2, a detailed plan on how the applicant intends to complete the pilot test described in Objectives 3 and 4, and how the proposed project will inform future improvements to technical infrastructure supporting the laboratory interoperability and standards-based laboratory data exchange. Identify an approach to improve the exchange and use of standardized laboratory data while adhering to applicable data security and privacy requirements, including the compliance with the HIPAA privacy rule and other relevant regulations. Next slide. Now I will transition to Yolanda to discuss the funding, eligibility, and application information.
Thank you, Priscilla. I'll now review the key details. This is a cooperative agreement. The available funding is up to $2 million and will be spread across 3 awards. The letter of intent due date is June the 30th, and all applications are due by July 16th. The anticipated award date is September 26th, and the performance period is for 2 years. And again, with the anticipated start date being September 26th. There are 3 areas of interest. Area 1 is 1 award up to $1 million. Areas of interest 2 and 3 are 1 award each at $500,000. The letters of intent are strongly encouraged to submit a non-binding email letter of intent to apply for this funding opportunity. They are not required, however, they are strongly encouraged. They are due by June the 30th, 2026 at 11:59 p.m. Eastern Standard Time. You can send your LOI to onc-leap@hhs.gov. Specify area interest 1, 2, or 3, name of the applicant organization, city, state of the applicant organization, and indicate the funding announcement number. The application process will include submit all materials electronically through grants.gov. This process is outlined in the Notice of Funding Opportunity. Contact grants.gov help desk at support@grants.gov or call 800-518-4726 for assistance with submitting applications on grants.gov. Have a unique entity identifier, UEI, and they can be obtained via registering at sam.gov. It usually typically takes 7 to 10 business days. Please plan accordingly. If you have already registered with SAM but have not renewed your registration in the last 12 months, you will need to renew your registration. Ensure that applications meet application requirements and page limits by the deadline. The application components, your abstract should be less than 500 words. The project narrative, 35 pages max. There is a standard form SF 424, has no limit. The standard form 424A, which is your budget for non-construction programs, has no limit. The 424B is the assurance for non-construction programs, along with the disclosure of lobbying activities, both of which have no limit. The budget and narrative justification has no limit, and your letters of commitment, there is no limit to those as well. The project abstract represents the high-level summary of the project that can be understood without reference to other parts of the application, and that provides a description of the proposed project, including project goals, objectives, overall approach, anticipated outcomes, products, and duration. The applicant shall place the following information at the top of the project abstract. That is the project title, the areas of interest, the applicant name, the physical address, contact name, contact phone numbers, email address, website address, if applicable. The project narrative should address the elements articulated in the area of interest section of this NOFO. The project narrative should also align with the performance goals and objectives and the merit review criteria presented in the NOFO. Applications that did not follow the outlined format must be reviewed by the ONC designated official. The format for the project narrative is that it must be double spaced, no more than 35 pages, formatted at 8.5 by 11 letter size, in Cambria or Times Roman font, 1-inch margins, and font size at 11 points, no greater. Or greater, excuse me. The project narrative should include the following components. These components will be counted as part of the page limit. The suggested lengths of the component are given below are guidelines to help the applicant create a balanced document. They are not mandatory restrictions. Understanding of the project purpose, 2 to 3 pages, the proposed approach and activities, 10 to 14 pages, the applicant capabilities, 9 to 15 pages, and the budget narrative, 2 to 3 pages. I'll transition it over to Priscilla to go through the understanding of the project purpose.
Thanks, Yolanda. This section should offer the applicant's conceptualization of the area of interest. This should include the applicant's perspective, a specific delineation of the objectives and research challenges the proposed project will address, specifically distinguishing between challenges that can be addressed in the self-contained project period of 2 years and challenges requiring a longer period of 3 years. Applicants shall clearly state which area of interest the proposed project will address. For the proposed approach and activities, applicants should provide a clear and concise description of the approach the applicant is proposing to use to conduct the research and development work, including identifying the major challenges and proposed activities used in the approach. This should be organized so that each element of the project plan is clear and aligns to the project's key objectives and project goals. The applicant should include the usage of novel concepts, approaches, methodologies, tools, and/or technologies, and provide insight as to how their usage will inform the field of health IT. The approach should also include proposed strategies on how the results of the project may be disseminated and transitions to the field at large. Next. The approach should include as much detail as possible given the page limitation. The plan for each activity at minimum shall state the following: specific aims, previous work of the investigative team on which the proposed research is directly based, the methods that will be applied, the anticipated outcomes of the work and their potential significance in addressing the challenges of the selected area of interest, and the key personnel who will be involved. The plan for disseminating and transitioning appropriate research results into practice should include a plan for engaging industry stakeholders to adopt, disseminate, and transition findings from the project into data standards, data infrastructures, health IT products, tools, and best practices. Collaborative arrangements with industry and other groups outside of the applicant institution should be accompanied by appropriate letters of support. In the event an applicant's solution includes the development of a prototype, the applicant should also submit a plan for approval by ONC, illustrating how the prototype will be made and maintained in a publicly available and acceptable domain at no cost to the general public. Applicants should provide a project timeline as an appendix to the application with a table of key dates and objectives to demonstrate that key dates can be met within the 2-year period. The applicant capabilities section should describe the applicant's project team, personnel qualifications, and past performance demonstrating experience consistent with successfully meeting the goals of the cooperative agreement. It is recommended that the project team be composed of, but not limited to, the following roles: project director or principal investigator. At least one person on the proposed project team shall possess health IT expertise. And for area of interest 1, the proposed research team must have expertise in the areas outlined in the NOFO. For area of interest 2, the proposed research team must have expertise in the areas outlined in the NOFO. For area of interest 3, the proposed research team must have expertise in the areas outlined in the NOFO. This section should describe plans to establish and operate a technical expert panel of relevant and appropriate stakeholders, including names of members who have committed to join or proposed to join to help inform the work to be conducted on the relevant area of interest. Organizational capability statement. This section should describe the organization's capabilities, qualifications, and approach to address the work to be completed. The statement should highlight potential strategies the organization may employ in an effort to sustain research efforts beyond the scope of the project timeline. The statement should include the relevant organizational resources available to perform the proposed project, including facilities, equipment, and other resources. Applicants who are working with the project counterparts as part of a consortia shall also provide letters of commitment from them. The letters of commitment shall be included with the appendices and will not count towards the 35-page limit. The budget narrative. This section should include a detailed breakdown of how the applicant plans to spend allotted resources to complete the activities detailed in the NOFO. Required appendices. Applicants may submit no more than 30 pages of appendix material. Do not use the appendix to circumvent the page limitation of the project narrative. The required appendices include the application for federal assistance, Form SF-424, the budget information for non-construction programs, Form SF-424A, assurances for non-construction programs, Form SF-424B, disclosure of lobbying activities, Form SF-LLL, budget and narrative justification, letters of commitment, proof of nonprofit status, and indirect cost agreements. Now I will pass it over to Yolanda to review the application responsiveness and merit review criteria.
The application review process. All applications must be submitted electronically through grants.gov. Grants.gov will issue an email receipt upon successful submission. Applications are reviewed for responsiveness and categorized as pass-fail. All applications that pass the review and responsiveness are forwarded for merit review. Once the merit review is complete, ONC will make an award. ONC, however, is not obligated to make an award if none of the applications meet the intent of the program requirements, or if there is a change in funding levels or availability of funds. Application responsiveness criteria. All applicants must meet the following completeness criteria, or they will be administratively eliminated and not sent forward for merit review. The applicant meets the eligibility criteria. Applications are received on or before the deadline of Thursday, July 16th, 2026 at 12 noon Eastern Time through grants.gov. The application contains all of the required components, such as the project narrative, the SF-424A, etc. The application meets all formatting and length requirements. Appendices and attachments are not used as a mechanism to extend or exceed the page limits of the project narrative. The merit review criteria. Responsive applications are forwarded for merit review. Merit review will be conducted by a panel of at least 3 experts in their field from academia, from academic institutions, nonprofit, and local and federal government agencies. Applications can receive a maximum of 100 points using the following scale. Understanding the project purpose, a maximum of 10 points. Proposed approach and activities, a maximum of 40 points. Applicant capabilities, 30 points. The budget narrative, 20 points, totaling 100 points. Understanding the project purpose, the maximum points is 10. The extent to which the application identifies an area of interest from the NOFO, the extent to which the application addresses the key objectives and goals as identified of this identified area of interest from the NOFO, the extent to which the application identifies the project plan and activities that align with the identified area of interest within the NOFO, the extent to which the application identifies barriers and ways to mitigate those barriers with the identified area of interest, to the extent in which the applicant describes how the project expected outcomes and the results will inform future health IT development, research, and implementation. Approach and activities is a 40-point maximum. The extent to which the approach, design, methods, and analysis are specifically stated, adequately developed, well integrated, and well reasoned, and appropriate to the project goals and key objectives of the area of interest, 20 points. To the extent in which the applicant proposes a clear and detailed plan for disseminating and transitioning appropriate research results into practice, This section of the application should include a plan for engaging industry stakeholders to adopt, disseminate, and transition findings from the project to stakeholders who will continue to advance the work. Is a maximum of 15 points. The extent to which the plan describes a project management approach for ensuring project success, 5 points. The applicant capabilities, a maximum of 30 points. The extent to which the applicant identifies all the resources necessary to perform the proposed work, the outlined strategies to complete this work within a 2-year time frame, 5 points. The extent to which the environment in which the work will be done contributes to the probability of success, employs useful collaborative arrangements, and has evidence of support within the awardee's institution, 5 points. The extent to which the project proposal integrates and provides an appropriate level of research, technical knowledge, and subject matter expertise, 20 points. And lastly, the budget narrative is 20 points. Does the application provide the proposed level of effort of the project team and consultants if needed, and describe how they are adequate and appropriate to advance a project in accordance with the project plan? Does the application include an explanation of how the proposed budget supports the project and is cost efficient and reasonable for meeting the project activities? Does the application include all the required budget information included in a budget section in the project narrative and the supplemental budget and narrative justification? Does the project align logically with the project's goals, objectives, and timeline? This concludes the information session for the LEAP 2026 program. Thank you for attending. We will remain on the line for 5 minutes. Please submit any remaining questions via the chat of this webinar. Questions submitted today in the chat will not be answered today. All questions must be submitted in writing, either via the chat during this webinar or emailed to the onc-leap@hhs.gov. All questions will be answered in the form of an FAQ and be made publicly available on the Health IT website. To see the NOFO on grants.gov or to apply, go to grants.gov, search results for the detail 362835. For assistance with submitting applications in grants.gov, please contact grants.gov help desk at support@grants.gov or call 800-518-4726.